Welcome, guys, to our gross anatomy lecture. Today, we're going to talk about the arm. Everything that contains the arm is going to be summarized well in this video. Let's get into it. Right, so your arm is going to be divided into an anterior fascial compartment and a posterior fascial compartment. Right, so you are going to have, remember, you have your skin, and then from the skin, you're going to have your superficial fascia that will be having your veins, your adipose tissue, as well as some cutaneous nerves. If you reflect the superficial fascia, you're going to enter into a deep fascia. So a deep fascia is named according to the part of the arm. The deep fascia of the arm, right, is going to be called brachial fascia. Of the forearm is going to be called antebrachial fascia. You understand? So the brachial fascia is going to send some septa that will attach the medial portion of the humerus. So the septa that is sent, which is called an intermuscular septum, because it is between muscles. If it is extended to the medial portion of your humerus, it's going to be called your medial intermuscular septum. Laterally, we are also going to have the deep fascia sending a lateral septum called a lateral intermuscular septum, attaching to the lateral portion of a humerus. So in this way, we have divided the arm into two: an anterior compartment, which is an anterior flexor compartment, and posterior extensor compartment. Usually, muscles that are in the anterior portion, they are flexors in the upper limb. Those in the posterior compartment, they are extensors. Now, let's take a look at these muscles. So we are going to start with the anterior fascial compartment. Let's take a look. Right, we can actually see another good diagram here. This is your humerus. This is your deep fascia or your brachial fascia. Medially, it sends the septa. This is a medial intermuscular septum, a lateral intermuscular septum, dividing your arm into your anterior flexor compartment, posterior extensor compartment. What are the muscles in the anterior flexor compartment? They are given by a mnemonic called BBC. BBC. Right. You are going to have your biceps brachii muscle. Your biceps brachii muscle, it's a muscle with the two heads. It is a long head and a short head. A long head, remember, it's that head that is within the bicipital groove that will be surrounded by a tubular sheath of synovial in the glenohumeral joint and attaches to your supraglenoid tubercle. Your short head will attach to the coracoid process, right? And then they meet and form this chunk of muscle, this belly, that too actually, so this is the origin, right? And then it inserts into what you call your bicipital tuberosity at your radial bone. And it also gives an aponeurosis that is called your bicipital aponeurosis, which we spoke about in the cubital fossa. So right here, that's your bicep brachii. Let's take a look at the long and the short end of the bicep brachii. Right, so we are talking about the bicep brachii. Let's take a zoom in. So it has a long head which attaches to your supraglenoid tubercle, and it is this long hair that's also stabilize the glenohumeral joint superiorly. This long hair is within the joint cavity, and it will be surrounded by a tubular sheath of synovial membrane. It's also going to have a short head, right? This short head, it attaches to the coracoid process of your scapula. The short head and the long head will join and form this muscle belly, and it's going to insert on the bicipital tuberosity of the radius, right? And give medially an upper neurosis that would attach the deep fascia of the skin. What are the actions of the biceps brachii? Right, the biceps brachii, it's a strong flexor at the elbow joint, a strong supinator at the elbow joint. It's actually involved in when you are um, turning the screw with the screwdriver, right? If you are turning the clockwise, the twisting turn is made by the biceps brachii. It is also a weak flexor at the shoulder joint, right? So take note, the biceps brachii has no attachment to the humerus. The biceps brachii has no attachment to the humerus. Good. So another muscle that forms that is in the anterior compartment of the arm is the coracobrachialis muscle. Right here is your coracobrachialis muscle. Your coracobrachialis muscle, it actually originates from the coracoid process and inserts on the medial portion of the mid half shaft of the humerus. It is actually a powerful flexor, right, of the arm and a weak adductor of the arm. And then another muscle, the third muscle, is going to be called your brachialis muscle. Your brachialis muscle originates halfway in the shaft of the humerus, and then it's actually attached to the coronoid process of the ulna, right? It also forms the floor of your cubital, your medial floor of your cubital fossa. Good. Let's take a look at the innervation of these muscles, right? So all these muscles are going to be innervated by the musculocutaneous nerve. The musculocutaneous nerve innervates the BBC. But the brachial muscle is going to have a dual innervation. It's going to be innervated by the medially by the musculocutaneous, laterally by the radial nerve. So take note of this. The brachialis muscle is a dual innervation. Good. Let's take a look at the course of the blood supply of the anterior compartment of the arm. Right, so the anterior compartment of the arm is going to be supplied by the brachial artery. Remember, the brachial artery, it starts at the lower border of the teres major as a continuation of the axillary artery. Right, so let's take a look at the course of the brachial artery. So the brachial artery will actually be uh, giving a lot of branches in your arm. The first branch is going to give right at its origin is going to be your profound brachial artery. Your profound brachial artery, it will be accompanied with your radial artery, move via the spiral groove, right? Supplying the posterior compartment of the arm, and then it's going to end up as the radial collateral artery. Good. The brachial artery will actually also give a superior ulnar collateral artery, and it is the superior ulnar collateral artery which will be accompanied by the ulnar nerve that will later pierce the medial intermuscular septum to enter the posterior compartment, and this is going to be involved in the elbow anastomosis. Inferiorly, the brachial artery is also going to give a superior ulnar collateral and inferior ulnar collateral, which is also going to be involved in elbow anastomosis. The brachial artery will terminate by bifurcating into an ulnar artery, which is larger, and a small radial artery at the neck of the radial bone. Good. Let's take a look at the relations of the brachial artery in the arm. Let me zoom a little bit. Right. So the brachial artery, right? So the artery is actually superficial, and its pulsations, they can actually be felt right at this in the medial aspect of the arm. So anteriorly, you are going to have the medial cutaneous nerve of the forearm that will lie anterior the brachial artery, right? And also at its middle portion, right here, you're going to have the median nerve, which I'm going to talk about very soon, is going to cross anteriorly to the brachial artery to go to its medial portion, right? And then in the bicipital groove, in the cubital fossa, let us take a look. So in the cubital fossa, you can actually see that the bicipital aponeurosis will be at the anterior portion of your brachial artery. Good. Posteriorly, the artery actually sits on the tricep muscle, on the Coracobrachialis incision, as you can actually see, and it actually sits also on the Brachialis muscle, right? What about medially? What is medial to the brachial artery? Well, you can actually see this is your ulnar nerve. So your ulnar nerve is actually medial to your brachial artery. You're also going to see at the lower part, right? The median nerve will also be medial because the median nerve will actually cross the brachial artery to enter to its medial portion. So at the upper portion, you have your brachial artery being lateral to your ulnar nerve. At the lower portion, your brachial artery will actually be lateral to your ulnar nerve and your median nerve. You understand? Good. What about laterally? Laterally, we are going to have your Coracobrachialis, right? You're also going to have your musculocutaneous nerve, right? You're also going to have your bicep muscle right here to be lateral, right? And at the lower proximity, right, you're actually going to see the tendon of the bicep together with the the radial nerve. They're actually going to be lateral in the cubital fossa to your brachial artery. Good. So let's take a look at the course of nerves within the anterior compartment of the arm. Now let's take a look at the musculocutaneous nerve. Take note, the musculocutaneous nerve is the nerve of the anterior compartment of the arm because it supplies the Coracobrachialis, the Brachialis, as well as the Biceps Brachii. They cause the musculocutaneous nerve. So the musculocutaneous nerve, it originates as a branch, a terminal branch of your lateral cord, right here, of your brachial plexus. Then it pierces your coracobrachialis right here. Also innervating. Remember, a muscle pierced by a nerve is innervated by that nerve. And then it's going to be sandwiched between your biceps brachii and your brachialis. So here you're going to have your biceps brachii, and then you're going to have your brachialis here. So it will be running between the biceps brachii and your brachialis. Good. Innervating the biceps brachii and the brachial and the brachialis as well. And then in the cubital fossa, the musculocutaneous nerve will actually pierce the deep fascia to enter the superficial fascia. And it's going to become the lateral cutaneous nerve of the forearm. So the musculocutaneous nerve, it will terminate becoming the lateral cutaneous nerve of the forearm. Let's take a look. Right, you can actually see the musculocutaneous nerve, right, between this is your bicep, this is your brachialis, between then in the level of your cubital fossa, it's gonna pierce the deep fascia to become superficial and become the lateral cutaneous nerve of the forearm. So this lateral cutaneous nerve of the forearm will actually supply or innervate the lateral portion of your forearm. Right. Let's take a course of the median nerve in the arm. Right. So the median nerve, it begins from the combination of your lateral cord, right, and your medial cord of the brachial plexus in the axilla. And then it descends lateral to the brachial artery, right? And then at the halfway, right here, the median nerve is actually going to cross anteriorly the brachial artery and enters the medial portion of the brachial artery, right? So the median nerve, right in the cubital fossa, as you're going to see, it's actually going to be medial to the brachial artery. Take note of this. The median nerve has no branches in the upper arm. It has no branches in the upper arm. Good. Let's take a look at the ulnar nerve. The ulnar nerve is going to be a continuation of the median cord. This is your ulnar nerve, right? And it runs downward on the medial side of your brachial artery, right? And then at the level of the incision of the coracobrachialis, the ulnar nerve is actually going to pierce, as we're going to see, it's going to pierce your medial intermuscular septum to enter the posterior compartment, right? Together with the superior ulnar collateral artery, right? They'll actually pierce and enter the posterior compartment, and the ulnar will travel along the posterior portion of your medial epicondyle and then enters the forearm between the edge of the flexor carpi ulnaris, right? Also, the ulnar nerve does not give any branches in the arm, right? So lastly, let's take a look at the the radial nerve. So the radial nerve is actually a posterior, the largest nerve of the brachial plexus, coming from the posterior cord of the brachial plexus, right? And then from the posterior cord, it will enter the triangular space, right? And then move along the spiral groove together with the profounder brachii artery, right? And then it is going to be in the anterior compartment at the at the at the distal lateral portion, right here, right? So the radial nerve will actually um, enter the anterior compartment by piercing the lateral intermuscular septum. So it's going to be in the anterior compartment at this position. That's at this position, that's where it's going to supply the lateral half of your brachialis muscle together with the brachioradialis muscle and the extensor carpi radialis longus. Right. So guys, that's everything that you have to know about the anterior compartment of the arm. Let's take a look at another video where we are going to talk about the posterior compartment of the arm. Thank you so much. Take care.